Hello everyone. Sometimes in many situations we will be requiring mechanical ventilation just for the protection of airways. For example, a spontaneously breathing patient of hepatic encephalopathy or some head injury related cases, CNS disorder patients, etc. In them we need to protect airways. So just for that we will be giving mechanical ventilatory support. So what should be the settings in that situations? So here is a small guide for that. So we have understood some situations. For example, airway protection in hepatic encephalopathy or CNS diseases where the individual is spontaneously breathing. So what should be the mode of choice? Ideally it should be assist control mechanical ventilation, or we can go ahead with SIMV mode, synchronized intermittent mandatory ventilation, or else just pressure support ventilation is also fine. Then what should be the respiratory rate, that is number of breaths per minute to set up is 10 to 14, and tidal volume if we focus upon it should be 8 to 10 ml per kg body weight. Suppose in adults if we take 70 kg, so we can keep a tidal volume of about 700 and lesser ml. And what about FiO2? Always begin with 100%. Then we need to obtain ABGs. Based on that we can wean till the saturation is maintained above 92%. To a minimum of, a goal should be to lower FiO2 till 40%. What about PEEP? Ideally we can keep 5. And we have to give some adjunctive treatments like DVT prophylaxis and gastrointestinal bleeding related care. And here the point to remember is, in case of hepatic encephalopathy, patients are often prone to develop respiratory alkalosis. So we have to keep an eye on this so that we can manipulate tidal volume. That is, we may need to reduce tidal volume to prevent respiratory alkalosis. So these are some initial ventilatory settings in these particular situations. Hope it is helpful. If you need such ventilatory guides in some other situations, comment that particular condition in the comment section. I will come up with the details in upcoming video. Thank you so much.